Next, I would like to introduce Dr. Tiffany Svan. Dr. Svan is a medical oncologist, breast specialist with Diablo Valley Oncology Hematology. So please welcome Dr. Svan.
Thank you, Joan, and hello to everybody out there. Thanks for coming. We're really excited about this morning. I think I speak for the whole panel. We've been looking forward to this for a while. This has been a program that's been in the making for a few months, so it's here, and we're really happy to see such a wonderful turnout. So thanks for coming out this morning. I know a lot of you in the audience. It's so nice to sit up there and see so many familiar faces. And for those that we don't know, we're so happy that you're joining us. And I do want to just take a minute to tell you a little bit more about our group and what we do. So myself and Dr. Kamath and Michelle Rooney all practice out of Diablo Valley Oncology, and we are part of the California Cancer and Research Institute located in Pleasant Hill. And we have a multidisciplinary cancer program which we feel very proud of, something that we've built over the last few years. We do have medical oncology services, which is what I specialize in, as well as Michelle. We have radiation oncology, Dr. Kamath as well. And then we have imaging, so we have PET scan, CAT scan there. We have a very active clinical research program with clinical trials available. And now as we partner more and more with the American Cancer Society, and we have been for a long time working with the wellness community, building a wellness program, having more programs with the idea behind it to treat the whole patient and not just treat the disease. And so this is really our mission. And part of this, we're really excited, and this is good timing for us, is starting in January of 2010, we're going to be implementing the use of survivorship care plans. So this is a program that we're really excited to be able to bring to you guys as well. So that's just a little bit about what we do in our group, and we're so happy to have some people here that we're not familiar with. It's nice to have you join us. So this is not a group that I need to talk about the importance of breast cancer to. Obviously, that we all know how important a health issue breast cancer is. It is the most common cancer in women, and it is the second most common cause of cancer death in women, second only to lung cancer. In 2008, these are our most recent statistics, there were more than 184,000 women diagnosed with breast cancer in this country. That's an astounding number of women diagnosed with breast cancer. And there were more than 41,000 deaths from breast cancer in the United States last year. But the number that I think is really important to talk about is the fact that over the past 2 decades, the death rate or the mortality from breast cancer has declined by 24%. So that's huge. And so that's why we have, as Joan mentioned, 2.5 million breast cancer survivors in this country. And you guys are part of that. So that's why survivorship issues are so important, and that's really why we're doing this program today. This is the first of its kind in the East Bay, this Many Faces of Breast Cancer program, and we hope, if it's successful and we get good feedback, that this is something we do on a regular basis. So what I would like to do is read to you the definition of a cancer survivor. And this is from the National Coalition for Cancer Survivorship. A cancer survivor is anyone with a history of cancer from the time of diagnosis and for the remainder of life, whether that is days or decades. And so you guys are breast cancer survivors from the day that you're diagnosed with breast cancer, the day that you begin living with this disease and battling it, you are a survivor. And so we have this huge survivorship pool. And the reason that we're doing so well with breast cancer and decreasing the death rates and improving cure rates is because we have such excellent screening programs. So we know that with mammography and some other imaging modalities, we can really detect breast cancer at a very early stage, very curable, and that's where we're getting these great numbers. Also, we have such a great array of treatment options now between surgery, radiation, different types of chemotherapies, hormonal therapies, and now the whole new world of what we call targeted or biologic agents. Herceptin is the most sort of popular, common one in the targeted agents. And all of these come together to make us have a disease that's really curable and a disease that women can live with for many, many, many years. So it's incredible. So what I do want to do is talk about 2 aspects of survivorship. And the way this program is going to work is we're not going to have a lot of time to do this actual speaking. What we want to really do is have a lot of time for questions and interaction in the second part of the program. So I'm just going to give sort of a general overview, and then more specific issues we can delve into a little bit more as people want to ask questions later on. So I see survivorship as 2 components. One is recurrence, the issue of recurrence. So when a woman has completed what I would think of as the acute phase of their cancer treatment, which may include surgery, radiation, potentially chemotherapy, those are sort of the more acute phases of treatment. After that, there's a period of watchful waiting where there's a concern that the breast cancer is going to come back. And every woman who's had breast cancer has that concern. And as I practice, I see that level of anxiety, it's real and it's there, and it decreases with time. The further you get from your breast cancer diagnosis, the less worried you are about that, and you learn to live with it a little bit more, but it's always there. And so monitoring for recurrence and the fear of recurrence is a huge part of this phase of treatment, which is called survivorship. And we really acknowledge that fear is real. I know that a lot of my patients will be concerned. I don't want to call you. I don't want to complain. I don't want to feel like I'm talking about symptoms too much. We want to hear that. We want to know what your worries are, and we want to be able to address them. As we have patients finish treatment, at least in our practice, we try to give out what we call the ASCO guidelines for breast cancer follow-up. We've included this in your packet today. ASCO is the American Society for Clinical Oncology, and they are sort of our governing body for medical oncology. They create guidelines that most of us who practice follow these guidelines, and these guidelines are based on data, evidence-based medicine. And so I do try to hand out this packet or this information sheet for my patients. When you're done with acute treatment, you're not done with me by any means. I do have some patients who say, am I going to see you again? You see me for 10 years usually, so it's a long relationship. What the sheet does recommend, and this is what I do, is that I see my patients every 3 to 4 months for the first 2 to 3 years or so, depending on what kinds of treatment they went through. And then we'll stretch visits out to every 6 months, and eventually it'll be once a year. And when you get to your 10-year anniversary, I give you an option. You can keep coming to see me once a year, which we love, or if you're kind of done with seeing so many doctors, you can move on and be seeing your primary care primarily. We do encourage that you continue to see primary care doctor right from the beginning of diagnosis. As you go through treatment, your oncologist will take over a lot of your acute medical issues, but we really want to try to keep the primary care physicians involved because you will be getting back to them when you're done with your treatment and get back to feeling like a healthy person again. So we don't like to cut out the other physicians. So that is outlined on that sheet. What we do during those visits may sometimes seem kind of mundane and that we're not doing very much, but there are two important aspects of the follow-up visit with your doctor. One of them is the history. And when you're seeing me or Michelle or your physician or nurse practitioner, we're going to be asking you questions that may seem like routine questions about pain and different things, but they, for us, are triggers that there may be a symptom, that there could be something concerning going on, and that we need to do some further investigation. So we really do pay attention to little details that really mean a lot to us as far as the amount of information it's providing and whether or not we need to go on and do some more workup like a scan. The other component of that follow-up visit is a physical exam, and physical exams are still very important. The physical exam of the breast or reconstructed breasts or chest wall and lymph nodes are very important for detecting local recurrences, as well as exams of the heart and lungs, liver, etc. So while it may seem like you're coming in for a little 15-minute visit, not a big deal, it actually is a big deal to keep coming in and seeing us and keep up with those visits. The packet does talk about also what we do for imaging once you've moved on to the survivorship phase. And really, the imaging that we do on a routine basis focuses on the breast itself. So in women who have not had mastectomies, bilateral mastectomies, so they have one or both breasts behind, imaging of the breast is very important. Women who've gone through lumpectomies or breast conservation will have mammograms every 6 months for the first 2 years, and the other breast, the unaffected breast, will have its mammogram yearly as before. And then after 2 years, you go back to once a year imaging of your breasts. And then in certain situations, we include ultrasounds and MRIs as well. So that's really the imaging that's done, in addition to bone density tests, which I'm going to talk about a little bit later. But we do not do routine PET scans, CAT scans, and bone scans in asymptomatic women. And this is sometimes a little bit hard for patients who are finished with treatment. How do I know it's gone? How do I know the treatment worked? How are you going to know when it comes back? And this has actually been studied very scientifically, that doing routine scans every 3-6 months actually doesn't improve outcomes in breast cancer, and all it does is raise anxiety levels, expose you to extra radiation. So the way that the ASCO guidelines recommend and the way that most oncologists practice is we will order scans to evaluate symptoms, but not just for routine screening. And that's sometimes hard for women to get their head around. And this is in most cases. There are some cases where there are some exceptions to that. So the other thing that I'd just like to touch on for a second is tumor markers. I do get a lot of questions about tumor markers. There are a few tumor markers out there that are sort of designed to try to screen for breast cancer recurrence, and they have actually been proven to be unreliable and very misleading. And they were used a lot more in the past. Some of you who may have some older physicians, I think, tend to use those a little bit more because they trained during the era of tumor markers. But in 2003, a large study, a meta-analysis, looked at tumor markers, found them to be unreliable, misleading, lots of false positives, and more importantly, they found that when women did have recurrences, the tumor markers did not go up. So I don't check tumor markers, and I think most of the oncologists now who follow ASCO guidelines do not check tumor markers. So laboratory work is not a big part of the follow-up care of breast cancer. Again, sometimes something people have to get their heads around a little bit. So in addition to providing that ASCO guidelines for follow-up, what we will be doing starting in January is development of the survivorship care plan. And what it is it's printed material that we will be filling out for you that will list all of the treatments that you've gone through. So what type of surgery you had, when you had it, who did it. If you had radiation, what were the doses of radiation in the fields generally, what kind of chemotherapy you got, doses and schedule, very specific, and information about if you're on hormonal therapy and what type and how long you've been on it. And so this is designed to be a care plan that's for you to have as a record, but also for you to disseminate to your other healthcare practitioners. And as we implement our electronic medical record, our goal is to be able to generate these reports electronically and email them or fax them off to your other physicians so that there's really coordination of care. You know, as we keep in the loop your other physicians, we think it's really important to have everybody know what kind of treatment you got, what are the side effects that they need to be looking out for when you do your yearly visits with them when they're doing their exams on you. And so this is something that we're finding to be very important, and we're really excited to get going with at Diablo Valley Oncology, and some of you may be doing that already with some other practices. The other aspect of survivorship is side effects. So there are long-term and short-term side effects from the treatments of breast cancer. And depending on what kind of treatment you've undergone or are still undergoing, so for hormonal therapy, that obviously goes on for 5 to 10 years, there are side effects that can be associated with that. Most of the side effects of hormonal therapy are side effects that are similar sometimes to menopausal side effects. So it's because we're depriving your body of estrogen. And so we see hot flashes, we see mood symptoms, we see weight gain, sometimes we see hair thinning. There are sexual side effects and sexual dysfunction. Those of you who are on aromatase inhibitors know about the joint aches that plague a lot of people. So there are a lot of side effects that as you're on these treatments, you have to live with. And as you're a survivor and going forward in your life, you're also battling these side effects that are very real. And we're here to help you manage those as best we can. We don't always have a perfect answer for all of them, but we can make things livable for you. And so the hormonal side effects are a big part of survivorship. Also in younger women, there are fertility issues that women deal with if they've had to undergo treatment at an early age, and women who have been put into an early menopause can also have similar side effects as the ones I've mentioned. So all of those are really part of issues that we address when we see you in those follow-up visits. Women who've gone through chemotherapy will be dealing potentially with fatigue, you know, a sense that they still haven't gotten themselves back 100%, and we know that takes time. Potentially neuropathy. We use a lot of taxane chemotherapies in our treatments, so some women live with a little bit of neuropathy, which is numbness, tingling in their fingers and toes or hands and feet. And then there's chemo brain, which we're learning more and more about, and there's a lot more research out there, but it's real, and it's out there, and we hear a lot about chemo brain. So those are some of the issues from chemotherapy. And then with the new biologic agent, particularly Herceptin has a side effect that's very, very uncommon, but is out there, which is a cardiac side effect or heart side effect, and Trish's going to talk about that a little bit. And we see that with Herceptin and with adriamycin, which is one of the chemotherapies that many people receive. And luckily is a rare side effect, and luckily is usually reversible, which Trish can also attest to, but is a very real side effect that some women have to live with. There are some other, what we would call cardiovascular side effects. There can be strokes, blood clots, not that often with these kinds of treatments, but those are real side effects as well. So there really are a lot of health issues that you all have to live with that are really important, and it's not just treatment is done when chemo number 8 is done. And so these are ongoing issues. One thing I just want to touch on, I know I'm way past my time, but I just want to mention bone health real quick. Bone health, osteopenia and osteoporosis, which is bone loss, is an issue that we have found as oncologists we're becoming specialists in because there is a lot of risk in women undergoing breast cancer treatments for potential bone loss. So we have learned as part of our training, from when I started my fellowship, we know how to read bone densities right away. So following bone densities are really important. Putting women into menopause early can affect bone health. Putting you on hormonal therapies can affect bone health. And what's kind of ties in with that, which is really exciting, is the class of drugs called bisphosphonates. Bisphosphonates, Fosamax, Actonel, Boniva, and the IV form Zometa are the treatments that we use to help build bone. But recently we've had some new data, and it's emerging and becoming very exciting, that this class of drugs has anti-cancer properties, and we're seeing decreases in breast cancer recurrence from this class of drugs. So that's something that more of you who are newly diagnosed may be seeing more and more. We have some clinical trials. So that's a really exciting issue, which I think really does fit into survivorship. So I'm going to finish up here, and we'll talk more when we have questions. Thank you so much.